Welcome to the AA Podcast, our little corner of the web where we are not afraid to discuss tough questions like,
when did nutrition, health, movement, and stress management become alternative medicine?
Where we embrace challenges in all aspects of life to become healthier and stronger versions of ourselves.
And where food and movement are the best kinds of medicine, and cooking meals at home is a revolutionary act. Hello, and welcome back to another episode of the AA Podcast. This is Ashley Olson.
And I'm Andrea Crane.
We are beyond excited about today's episode, and we will do a proper introduction of our amazing guests here in a bit. But before we do that, we will be sharing our weekly Bible verse, and mine is coming from Psalm 103, 2 through 3, and it says, "Bless the Lord, O my soul, and forget not all his benefits, who forgives all your iniquity, who heals all your diseases."
That is amazing. And since we are one day post Mother's Day as we're recording this, I chose Proverbs 31, of course, 28 through 29. And it is, her children rise up and call her blessed, her husband also, and he praises her. Many women have done excellently, but you surpass them all.
Oh,
So,
I love it. Well, Andrea, we did a proper introduction with
mhm.
our guest, but we have Dr. Craig Clayton on the episode today, and oh my gosh, we both are just our mouths dropped multiple
but then
times.
but then quickly closed because we don't want
Yes,
to be mouth breathing. So,
exactly. But I have no doubt this will be a fascinating episode for our
mhm.
listeners. And without further ado, let's dive in. Welcome back to the AA Podcast. We are so excited about today's episode, and I definitely know you're not going to want to miss this one. We are diving into a topic that often gets overlooked in the overall health conversations. We're talking airway health and from a functional perspective.
And our guest today is going to be Dr. Craig Clayton. He is a biomimetic family dentist based in Meridian, Idaho, who's known for taking a whole body approach to dental care. So he's a doctor of dental medicine from the University of Kentucky, but also a graduate from the Institute for Biomimetic Dentistry. He is extremely knowledgeable and experienced with the evaluation and treatment of airway issues, which is why I'm so excited to have him on today. And he treats patients of all ages. We are absolutely thrilled to have the opportunity to chat with Dr. Clayton about this important issue that has the potential to really heavily impact all aspects of health. This episode is going to be packed with insights. It might actually change the way you view your dental care and your overall health. So let's get into it. Welcome, Dr. Clayton.
Thank you. It's a pleasure to be here. Pleasure to be
Yeah,
here.
awesome.
Well, we are so excited to dive into this topic, but why don't we start with some basics? So, Dr. Clayton, can you just talk to us, tell us about yourself and where you're from? Where did you get into dentistry? How did this whole journey start for you?
Okay, I just want to first of all take credit for that for this get. He is local to me here in Idaho, and so yes, we begged. He answered the call, and so we're very grateful that he's agreed to spend some time with us today. So yeah, Dr. Clayton, dig in. Tell us about yourself.
Okay. I grew up in Southern California. Grew up surfing, enjoying the beach. Went to school in Idaho and Utah. And then my wife and I moved to Kentucky, where I attended dental school. And I chose dental school I like working with my hands. I enjoy biology. I thought about becoming a surgeon, but I just, the length of time commitment I was not excited about, especially the time away from the family is extremely significant. And so I chose dentistry, and then in my first year of dentistry, year and a half, became very disillusioned and thought, what am I doing? Like, I think I've made the wrong decision.
Wow.
But I obviously decided to stick it out, but seriously considered dropping out about halfway through my second year.
Wow.
What made you
But just,
stick to it? Just because you put so much time in, or
I
Sunk
mean,
costs.
yeah, sunk cost was one
Mhm.
thing. I'm like, well, the careers that I'd like to choose definitely won't pay for that student loan.
That
So
that's big.
so that's
Yep.
big. Sometimes I wish I would have just dropped out and gotten on an income based repayment plan, but here we are. So that's the honest truth. But
Yeah,
as
that is
as
so
I
honest.
as I just grasped for anything to keep my head above water, I
Mm,
slowly discovered a more whole body approach and more modern, conservative, restorative treatment. So,
mm,
fixing teeth, for lack of a better term.
mhm,
And that led me, that and patient questions and curiosities led me to where I am today.
mhm,
And I'm grateful to be here, and ultimately grateful for the impact that
mhm.
I'm able to have
Yeah.
on teaching about oral health and the importance in whole body wellness. So I'm glad to be able to fill that role today, but it's been a journey to get here and
Mhm.
continues to be quite a journey. Always learning, always changing.
Yeah. Well, I know you're doing excellent work because I send people to you and I hear really great things. So we're glad you stuck it out. Your patients are glad you stuck it out and found your passion.
Yeah. So why don't we
Yeah,
start
I'm
with some
glad.
of the basics? What exactly is biomimetic dentistry? I had never
Yeah.
heard of it before. And how is it different than traditional dentistry?
So biomimetic dentistry focuses on more the restorative aspect of fixing teeth. So of course that's a big component in dentistry.
Mm,
All end goal is to get people out of the cavity cycle, um, because I don't want to have to do restorative work. It's not why I got into dentistry, and because it's a part of my job, I wanted to learn the most conservative way of practicing. And so biomimetic dentistry is the art of restoring teeth using materials that behave similar to natural tooth structure, so that
love it.
the teeth have the best chance of surviving long term. Um, so it's a lot less aggressive. It's very customized to patients, and it uses modern advanced techniques to make sure that the tooth doesn't get overstressed and
Mm,
need future treatment. So it's a great way of restoring teeth. I wish it was the gold standard. It's not,
mhm,
um, and that's a whole conversation in itself of you know my theories and opinions as to why. But it
mhm.
is growing. It is a growing specialty, but it's still not nearly, uh, the access to it is still very, very restricted. Um,
Yeah.
so
Yeah, I agree, and our audience is familiar with functional medicine, and perhaps they're familiar with biological dentistry, and this is very much in keeping with what you do. And so yeah, I love that conservative approach, and really it's conservation of tissue that we're designed to have, right?
exactly,
Yeah. So
exactly.
when we were, gosh, when we first scheduled Dr. Clayton, there were so many different directions that we could go with this show, because we're so interested in oral health. It's just critical, and there's so
Hmm.
little known about it out in the public, I feel. But when I started to go through a lot of your social media and the things that you talk about and what you're really passionate about, one thing kept floating to the surface, and this is a reason for a lot of my referrals, is because of airway patency. And so just how do we manage that airway? And there this is one of the big, gosh, I'd say one of the big areas where biomimetic dentistry kind of diverges from traditional dentistry is this issue of airway and looking at airway. And so if you've been to a conventional dentist your whole life, you may have not ever even heard about your airway, or that it may be compromised. And so I'm wondering, for you, Dr. Clayton, when did you first realize that optimizing airway, both patency and efficiency, was going to be a primary endpoint that you were, as a goal, going to have for your patients?
That's a great question. I just realized I just realized my microphone is selected as my MacBook and
Yeah,
not my microphone that's in front of me, so the sound is not going to be great.
it sounds really good
I
on our side.
it
Does
does
it?
it, yeah, it sounds great over here.
Okay, well, I guess we'll just leave it like that. Yeah, it's just the microphone on the computer. So if that sounds okay,
Okay.
then we'll just
It's actually quite good.
okay. Okay,
Yeah.
cool. All right. So back to the question. Uh,
Yeah.
I became introduced to airway health in dentistry via a what would you call it? Via a seminar, a free
Mm,
seminar that was hosted here February of 2023.
okay.
Think it was, and it was Dr. Zoggy of the Breathe Institute and a couple other providers that spoke at it, and it really answered quite a few questions, as well as just opened my eyes into the importance of airway patency, airway health in the development of the jaw bones and the facial structure, um,
Mm,
and then how it impacts dental health and alignment and all these things. And one of the things that really caught my attention was the teaching, the reality that the worn teeth that we see in children and adults
mhm,
is often the caused by the lower jaw being pushed forward at night, and the
mm,
brain does that to open up the airway. And so as that lower jaw slides forward, the teeth slide against each other. And as they do that over and over and over again all night long, multiplied by days, months, years,
mm.
the teeth wear down.
Inter
And I saw that in my boys. I have two boys. They're 5 and 7 now, but then they were 3 and 5, and I was really kind of heartbroken because they're wearing down their teeth. I'm a dentist. I don't know why. I don't know what to do about it. I called a pediatric dentist. That was a colleague, and he said, they'll just grow out of it. Don't give them sugar at night. It makes their brain really active. Um, okay, that's not the response I was looking for, but if that's what you say, and then I was told, well, if they don't grow out of it when they start getting their permanent teeth in, if they're wearing their permanent teeth, then we'll just give them a night guard.
Mm,
Um, and when I listened to Dr. Zoggy and Dr. Pinto teach, this is something one of the symptoms that they brought up was worn teeth, and explained why.
wow.
And then as I sat through this seminar, um, I began to check boxes of symptoms
Mm,
that I've seen my kids
hmm,
um, experience: the grinding, the restless sleep, the upward tilt of the head to open up the airway, open mouth, uh, mouth breathing. So all these sorts of things. I saw the smoke of this potential fire of airway health, and
mm,
that's what started my journey. So I went to Dr. Zaghi's course later that fall, and have just from there continued to learn,
mm,
and implement systems in my practice to
mhm.
help screen, identify patients that need this help, and that's where we are today.
Yeah.
Wow.
That's a really personal way to get into this, and I think so many of us enter in because of very, very personal situations. Yeah.
Yeah.
Yeah, absolutely. I agree.
So a lot of our listeners and maybe even us individually have dealt with
Mhm,
like fatigue or ADHD or even like maybe had some cardiovascular concerns either from family history or whatnot. So how is that related to poor airway function or oral posture, and how does that affect our overall health?
Yeah. I like a quote of "For breath is life."
mm,
So, we can go without food for a long time. We can go without water for a surprising long, long time, but we can't go without oxygen.
no.
Hmm.
And what is happening at night, how airway affects our health is a number of reasons. One that I like to point out the most is when we have a compromised airway and we're sleeping at night, when we enter that REM sleep, which is the most restorative sleep,
Mhm.
if there is an airway, well, what happens when we enter REM sleep is our voluntary muscles, so the muscles that we move that are not required to maintain life,
Mhm.
you
Mhm.
know, heart, diaphragm for the lungs, those are two muscles that have to work continuously. But the rest, a lot of the other muscles relax, including the tongue. So if that tongue doesn't have good posture, there's not enough room in the mouth, um, or there's some other things that can compromise airway health, like swollen tonsils, adenoids,
Mhm.
chronic congestion, things like that. Then we enter that REM sleep, the airway muscles relax, the tongue relaxes, falls back in, the body gets stressed, blood oxygen drops, and then the body wakes up out of REM back into a lighter stage of sleep. So that translates into fatigue and exhaustion no matter how many hours you sleep. So in
Mhm.
kids, we'll start to see signs of dark circles under the eyes. Uh, we'll start to see changes in the facial structures. The eyes may start to tilt. The corners of the eyes on the outside may start to tilt downwards a little bit.
Mhm.
The
Mhm.
nostrils start to become more flared. Um, and what's really important about REM sleep is growth hormone, glucagon, insulins, estrogen, testosterone. A lot of these hormones are released to heal the body. Uh, and so if you're not getting this restful sleep, the body's not being restored. So um, and then yeah, chronic fatigue, exhaustion, delayed healing,
Mhm.
delayed growth. We'll see kids that when we correct airway problems, we get them breathing better, then they start to hit rapid growth spurts because all of a sudden their body
Oh,
gets the hormones that it needs to restore and grow. So it's really fascinating.
yeah. Yeah. That's and so I'd like to ask about another population too, since we're kind of on this apneic discussion. A lot of people associate these kinds of disordered breathing patterns at night with maybe older adults, maybe heavy drinkers, maybe those with a lot of excess weight or a large neck circumference. um, are you seeing, like I'm seeing, a lot of really, slightly built people that don't have, excessive tonsillar tissue, or people that you would never think to screen for apnea? Are you seeing that in your practice
Oh
as
yeah,
well?
every single day. It's very rare that I have a patient with a palate that's wider than 35 millimeters.
Is that, and
And
and for those of us that don't have a I have no
so
frame of
30
reference for that.
so for
Open your mouth.
example, nor
Yeah.
normal normal
Mhm.
accepted palate width should be between 38 and 40 millimeters.
Wow. Yeah.
And we want even wider. I mean, the
Mhm.
wider we get, the better. And the
Mhm.
reason is, and we don't want to just focus on palate width. It's the roof of the mouth is the floor of the nose. So the wider the
Mm.
jaw is, not
Mhm.
only do we have room for the tongue to rest properly, so it doesn't fall back in the airway, because that's a significant concern. If I have a male patient that's 200 pounds,
Mhm.
big guy built, so lost lots of soft tissue weight, and his jaw is 29 millimeters and he has a big tongue,
Mm.
it has
Mhm.
nowhere to go. But also, when we expand the upper jaw, then we expand the nasal cavity. So then we can
Wow.
get more air in through the nose. And so that really is the primary goal for expansion, is we need to get that nasal passage nice and broad open. Um, and then we get air in a lot easier.
Okay.
So yeah, on patients are too narrow, their nasal cavities are too small, and it's something I see every day, whether or not they've had orthodontic treatment. And there's a study by McNamara that shows that up to 60% of patients that have gone through expansion in orthodontics relapse.
Wow.
So they get expanded and then their jaws just shrink again.
Wow.
Interesting.
So so
Huh.
it's not just form we have to correct, it's function as well. If we don't correct the
Mhm.
function of the muscles, because the 26 muscles that are responsible for chewing, speaking, swallowing are also the muscles that maintain the airway, that
Okay.
maintain the position of the teeth and
Mhm.
the width of the jaws. So if we're not correcting the function of those muscles, then we
Right.
can correct the form all day long, but we're going to have issues.
And I imagine, like, we talk about those isotonic contractions, like, just even like stabilizer muscles when we're standing, right? Those
Yeah,
paraspinous that are always sort of in various states of contraction.
yeah,
There's probably similar analogs within the mouth too to maintain an airway that need to become trained, if you will,
yeah.
um, at night. That makes a lot of sense. Wow, and we don't learn about
No, no, I
any of
didn't
these
either.
things.
I didn't
It's
either. We talked
yeah,
about, yeah, caries in children, and
right.
so cavities in children and even
Mhm.
adults,
Yeah.
we have our orthodontic classes in dental school, but
Mhm.
to my
Mhm.
recollection, we didn't talk about the significant impact of open
Huh.
mouth breathing
Okay.
and airway health in cavity prevention. We talked about a dry mouth, but we didn't talk about airway specifically, which I see as one of the most underdiagnosed risk factors for cavities. And then we didn't talk about
Yeah.
that with orthodontics either. We
Mm.
at large, it was measuring the teeth and measuring the arch,
Mhm.
and calculating whether or not we had enough room for all the teeth minus the wisdom teeth. But we didn't talk about tongue posture and muscles and tongue ties and breathing through the nose versus breathing through the mouth. All those
Mm.
things that truly affect the form
Yeah.
that orthodontics is always seeking to treat,
Mhm.
first and foremost. So
Okay.
So
Well,
what are
you
some
talked about
yeah.
you talked about children and what we can see in kids, if there is airway compromise. Can you talk a little bit? Are the symptoms more subtle in adults, or are they different, or are they very similar for an adult that might have an airway issue?
they really are quite quite the same. So an
Okay.
adult may have
Okay.
restless sleep. They may also tilt their head up. Um, Snoring's a big one.
Mhm.
Just open mouth breathing, just mouth breathing at night is a big sign symptom. So they'll have a dry mouth.
Mm.
Snoring or noisy breathing. So even if they're
Mhm.
breathing through their nose, if it sounds labored or it's loud, I mean, breathing should be silent and through the nose. So you
Mm.
shouldn't be able to hear it. In fact, some people teach you should be able to hold a feather beneath your nose and have it not move, like slow, gentle breathing
Mm.
through the nose.
So that takes
Um,
practice.
yeah, yeah.
Mhm.
And we're supposed to be breathing through our nose 90 to 95% of the time. And then the other 5 to 10% of the time, we're using our mouth to breathe, but not really to breathe, but to more vocalize. But, then we get
Mm.
the oxygen as well. Um,
Right.
so, yeah. And one of the big symptoms we look for, grinding of the teeth, we'll see the same tooth wear patterns
Mm.
in adults, and it often gets misdiagnosed as just teeth grinding.
Hmm.
But if I have the patient slide their teeth side to side, the teeth don't line up all the way as far as
Oh.
the grinding. But if I have them move their jaw forward, then all of a sudden all of those teeth with the worn surfaces line up perfectly. So it's just confirms the fact that they're moving their jaw forward to open up the airway. I compare it to CPR. CPR, we're taught to lift the chin up.
Mm.
It pulls the tongue out of the airway, opens it up. Um, and then posture plays a big role in it too. Incorrect posture can
Ooh,
narrow
that
the
makes me want to
airway
sit
by
up
up to
straight.
it can narrow the airway by up to 25%,
Wow.
just with a little change in angulation of the shoulders and the head. Um,
I'm sitting up straight. Okay.
So
Got it.
one of the cues I use with my clients is create spaces between your masses. So your head is mass, your neck is space and your chest cavity is mass. So I say create that space, like,
Mm.
and as soon as I say it, it's like a string pulling them up taller.
Mhm.
Yeah. Yeah, there's it's a critical space. There is a there's a dentist that's just a real expert in the field, incredibly intelligent, published published research. He's writing a textbook right now, like just
Mm,
wonderful person. And something he talks about is these critical spaces in our body.
mm,
Like there has to be a certain distance between the nerves, the nerve cells for that nerve impulse to progress.
mhm,
There has to be a perfect um, distance between the bloodstream and the very end of those little tiny spaces in the lung for
mhm.
oxygen to get through. But then that critical space of airway is too often ignored. Of it's
Wow.
another critical space, but then
Yeah.
we look past it and say, "Oh, that's good enough."
Right.
Or prescribe things like a CPAP or a mouth guard or a weight loss, when in reality, it's like there are things that are less invasive, more tolerable, and actually treat the cause
Mm.
that we need to be looking at.
That's amazing. So how early should parents be looking at signs? Like, are we talking day one of birth? Like,
Yeah.
Wow.
Yeah.
Wow.
Day one, really day one.
Wow.
If that child is can't breathe through their nose well, um, we look at tongue ties in infants, and not every tie has to be released. So I want to be very clear on that. I think there has been a history of overdiagnosis and overtreatment, which has given that procedure a bad name, bad reputation. But that affects airways well. Again, if the tongue can't go up and rest on the roof of the mouth, it's going to be in the throat. So, and restless sleeping, tilting the head up, sleeping with the bum up in the air, um,
Mm,
those are
it's
all.
all cute, but it's all signs.
It may be cute, but
mm,
it's a sign that they're not breathing well. So
mhm,
yeah,
So, I mean, we establish a child at for their primary, pediatrician.
mhm.
So it sounds like, would you recommend somebody establishing a baby, like a newborn baby, with like a dentist with like yourself?
yeah. I mean, it starts with as an infant. Starts with lactation. A lactation
Mhm.
consultant is
Okay.
great at being able to identify a lot of those things. Um, and then as dentists, once kids start to get their teeth in, then that's generally when we start to step in with care, unless we've had to address issues like oral ties.
Mhm.
If the baby isn't breastfeeding well, primarily, because that can make the difference. Um, so that can make the difference big time.
Mhm.
Yeah.
Mhm.
Why don't we dive into tongue ties? Because I know a lot of my friends, they have newborns or babies, or even clients that have. I just actually had a client that had her daughter tongue ties release. So, can you tell us what that is and maybe the types that there are, and how common are they becoming?
Yeah, they're very, very common. If you lift up your tongue and look in the mirror, you'll see a thin band of tissue. Yep, there it is. Um, Ashley just lifted up her tongue,
Yep.
and you can see it. You can see it
Thank you,
prominent right
Ashley.
there.
Yes. We'll
So
we'll do a
most of
freeze
us,
frame later. Frenulum.
perfect.
Right. Right.
So we having a frenulum or frenum is normal. It's normal to have that tissue, that attachment to the floor of the mouth. What's not normal is to have excess tissue. And so when you lift up your tongue and you see that thin band of tissue in the front, or sometimes that thin band of tissue is not very apparent initially, but we look at tongue mobility as far as, can it rest on the roof of the mouth? Is it held down in the back where it can't get out of the airway? Those are things that we're assessing.
Can you touch
Um,
your tongue to your nose?
Yeah. Well, it's interesting that that actually isn't a good diagnostic. Um,
Huh.
that's one of the biggest problems is you know is one of the biggest problems with diagnosing a tongue tie is a practitioner may just ask the child or the adult, stick your tongue out, and if you can stick out your tongue, um, a decent amount, then they say, oh no, you're not tongue tied. But then if we take a 3D X-ray and we look at their tongue posture, the back 2/3 of the tongue can't even rest on the roof of the mouth because they have a
Mm.
posterior tongue tie.
Mm.
Oh,
So
interesting.
it's not
Mm.
being diagnosed correctly.
Mhm.
Um, and that's why, again, the American Academy of Pediatricians published an opinion that tongue ties don't exist. That this is a procedure that's overdiagnosed. It's dangerous. It doesn't make a difference in speech sounds. It doesn't make a difference in nursing. It was a very damning article when they don't.
Consider the source. Sorry.
E
Uh,
exactly, exactly. Unless it was all the way to the tip where they couldn't move the tongue at all. It's like, "Oh, they
mhm.
don't exist." It's like, "Okay, well, why do we see problems with nursing? Why do we see
Mhm.
problems with breathing? Why
Mhm.
do we see problems with speech? Why do we
Mhm.
see underdevelopment of the jaws?"
Yeah. That
It's
are
really.
resolved post-release.
Yeah, and then we have all this
Right.
data that when we do the
Mhm.
therapy and the body work and the release, because it's multifaceted. You can't
Right.
just do a release and things aren't going to get better just because you do a
Mhm.
release. It requires a whole
Yeah.
team of care providers, but we have
Yeah.
so much evidence that shows this can be a major critical factor
Mm-hmm.
Mhm.
um, in making progress.
And I know from speaking to some friends, this isn't just something that you do necessarily at childhood. There are instances, or maybe you can talk to it a little bit more on if you recommend it, of adults getting their tongue ties released.
Yeah, 100%. So if I have a patient that's snoring or just chronically feeling fatigued, exhausted in the morning, we do a sleep screening. So we send them home with a device to measure their blood oxygen saturation throughout the night. So more unofficial than like a sleep study,
Yeah.
Mm. Mhm.
but it still gives us good data. Then that's one of the go tos is, okay, well, is there a tongue tie? Like, is that patient able to rest the tongue on the roof of the mouth to get it out of the airway? And if we always put them through different therapies first before we evaluate whether it needs to be released. But yeah, if there is a tie, and they're not able to make enough progress because their tongue just doesn't have enough mobility, especially the back of the tongue, then 100%, yeah, releases are performed on anybody from 0 years old to 80 years old. It
Mm.
is, if they're having an issue and that's a factor, then we take care of it.
Mhm. Well, so I'm wondering, gosh, I'm learning so much here that is going to be so helpful. Um, I'm wondering what are the risks associated with getting these treated? Because of course, we all hear about the overuse of like laser
Yeah.
frenulometectomies and these hideous complications that occur, and of course those get much blown up
Yeah.
in the reports. But I'm wondering, are there true risks and benefits? Obviously there are benefits, but what are some of the risks that might be involved?
So the major risks are what we see with any surgery. No risk of bleeding,
Mm,
pain, poor healing, infection, those sorts of things that we would
mm-hmm,
see with any other surgery. The biggest risk to function, um, if it's a traumatic experience for a young child or an infant,
mm,
we may see it affect feeding and create aversions to oral aversions.
mm-hmm,
So difficulty putting anything in their mouth besides soft food or liquids.
mm-hmm,
Um, those are definitely extreme cases. Uh,
mm-hmm,
and then another thing that we may see is mainly in adults is if the work hasn't been done and the screening hasn't been done properly,
Mhm.
we could actually make the sleep apnea worse,
Oh, wow.
because
Okay.
if there's not a big airway and there's no room in the mouth, and then we release a tongue tie,
Mhm.
well, there's no room for it to rest where it needs to. And so now it can fall back into the airway further. Um,
Right. That makes sense. That makes
but
sense.
modern techniques using a CO2 laser, the studies show it's less painful, the wounds heal better, less complications, uh, because those wounds don't bleed as much, and sometimes they don't bleed at all.
Hmm.
Um, just depends on the person's anatomy. So it's a much better procedure than, say, using a diode laser or
Mm.
scissors. Um,
Yeah.
so the post-op complications truly are very, very low.
Mhm.
But
Mhm.
besides just the general little soreness, maybe a little swelling,
Mhm.
discomfort. But even then, I've had tongue tie release and lip tie releases, and it's really not anything that's a big deal.
That's fantastic. What is the time frame in terms of recovery for kids versus grown-ups?
Generally, about 10 to 14 days.
Okay.
So 10 to 14 days. The first 3 to 5 days, uh, generally will experience the most discomfort, because that's when that inflammatory process is really
Sure.
at its peak. Or I'd say 2 to 5 days, and then after that, the wound after 7 days is pretty, is well on its way to healing.
Mm.
And then what's critical from day 5 to 7 onwards is when the tissue will start to contract as it heals. So
Uh-huh.
then it's really essential to do the stretches and
Yeah.
the exercises to keep the tissue loose and mobile, to not lose the benefits of that
Mhm.
tongue tie or lip tie release.
Yeah, that makes a lot of sense. So I wanted to switch gears a little bit and just talk about again with apnea because I just see so much of it. And even if it's not frank apnea, right? There are still
Yeah.
breathing issues at night.
Yes.
And CPAP, my goodness, I know that it is a difference maker because I've seen it,
Yeah. Oh yeah.
I've seen it just, people will tell me I hear birds, I see colors. I like the world is a different place now because,
Yeah.
it's because you're oxygenating at night.
Yeah.
But uh, but CPAP is such an invasive, obstructive intervention. And so I'm wondering, uh, I always recommend that my patients go like if it's a mild to moderate, like let's get an evaluation. Like let's get an evaluation. Let's see if an appliance would be appropriate here. But I'm wondering with talking to you, can you speak a little bit to appliances and can you speak to the other options? What does that look like? And let's say that there isn't a tongue tie. Let's say that I've already looked at sinus tissue and tonsillar edema, and there none of those things exist. So in that context, what options do we have?
That's a great question. For some people, the CPAP really is the best option,
Mm.
because in people that really have compromised airways, they get an immediate benefit. They go from not being able to breathe to
Hmm.
breathing. Um, Patients that don't tolerate that uh, can benefit from an appliance that pulls the lower jaw forward and keeps it forward, and
Hmm.
that tongue is connected to the lower jaw.
Okay.
Excuse me.
Okay.
And so I'm a chronic yawner.
That's why your
Uh,
palate is so beautiful, I'm sure. That's
so uh, let's see. So
so
the
le-
oral appliance can be a
yeah.
good option, but when it comes down to it, if there's not a severe lack of space and a huge tongue and tonsils and whatnot, then I always recommend body work. So that can be
Okay.
physical therapy, chiropractic care, and then oral facial myofunctional therapy to train those 26 muscles to
Mm.
work effectively and do what they're supposed to do.
Mhm.
And then for some patients, if they're up to it, there are surgical treatments that can be done to widen
Mm.
that maxillary bone. Which, if you look at the top of the nose and then trace a triangle under the eyes to the side of your upper jaw, that's the maxillary bone or the maxilla. And ideally, we need to expand the entire bone,
Mm.
because then when we expand the upper jaw, we're also expanding the floor of the nose. So there are some new surgical techniques
Mm.
that can accomplish that, and that can be life changing and really address the root cause. Um, and then we can get patients off a CPAP and off an oral appliance because we've actually fixed the problem.
Mm.
Wow. Hey, so I want to pin you down here because this is so appropriate for so many people. How do people find? So let's say that they have this newly diagnosed apnea, or that they know they're having problems. How do they find a physical therapist or chiropractor that is well versed in, myofunctional therapies? How do they do their due diligence there?
I think one of the first routes would be to find an airway.
He's really interested,
I
guys.
love it. I I
It's not
love it.
because I'm not yawning because I'm bored.
Nope.
I
You're just
yawn. I
getting
was yawning.
fresh extra oxygen into the
Oh
That's
my
brain.
right.
gosh.
Yeah.
Yeah, just trying to get more oxygen.
That's
Um,
amazing.
I yawned so much.
Mhm.
Okay, so finding an airways focused
Mhm.
dentist, doing a Google search for an airway dentist or airway orthodontist, and they typically will have a team of providers that they work with:
Mm.
oral
Oh,
facial
great idea. Yeah.
myofunctional therapists, physical therapists, chiropractors, and they can get you the resources um,
Okay.
to get started. There's a great website called Airway Circle, and
Mm.
that's a growing directory of airway focused providers
Okay.
for the United States. So
And you
that
said
though,
airway circle?
Mhm.
yeah.
Okay.
That's awesome.
I'm writing that down. Thank you.
So those are two great things, or two things that you can do to find a provider. But finding that one, at least one provider that's airway focused and root cause focused, because some people will do airway dentistry, but more conventionally as far as like
Mm.
oral appliances, versus the therapies and the body work to address that root cause.
Mhm. Mhm.
Is that website a good place to even find a general dentist? Like, would they be more holistic in their approach?
Yeah, so that is a growing resource. There's definitely more body workers and oral facial myofunctional therapists that are going to be on that website, but they will be connected because that oral health component is a necessary part.
Mm.
And often, it's not unlikely that a dentist in that field, in that discipline, will also be more root cause holistic focused, for
Okay,
sure.
awesome. I know we talked about sleep, and this is not necessarily a question on our list, but we're talking about apnea. But do you see where you don't have necessarily apnea diagnosed, but people are having trouble with staying asleep? Is that part of an airway? Could that be part of an airway as well? Because
Yes,
beginning you were
yeah.
talking about the rim and then the brain coming out of that rim because it's the tongue.
Yeah, so another diagnosis is called UARS, or upper airway resistance syndrome. So not full-blown sleep apnea. So sleep apnea, we have to see a certain number of events per night where a patient just stops breathing, like altogether, no breathing,
Mhm.
versus upper airway resistance syndrome. we'll see more periods of throughout sleep where there's less oxygen saturation, but there's not necessarily apnea. There's what we
Mm,
call hypopneic events.
mm,
So so that's something we'll see. Um, it was termed by Dr. Guilleminault that was up at Stanford, and he's really the father of sleep medicine. He's the one that coined
mm.
the phrase sleep apnea, and then
Wow.
coined the phrase upper airway resistance syndrome. And he was a real leader in the field. And he
Mm,
passed, I think it was 2019. Um,
Hmm.
and he's the main doctor that really trains Dr. Sarush Zaghi, who's a leading expert in
wow.
this field. He's an ENT. Um, so it's been an interesting process. But yeah, upper airway resistance syndrome would be that other,
Mm,
you know, diagnosis for, they're not snoring, they're not truly apneic, but they're still not well.
Mm.
mhm, mhm. Um, so kind of the place I'd like to land our really pithy content is talking about mouth breathing, dry mouth resulting from these airway issues. We we have talked a little bit on our show about dry mouth and its impact on the microbiome, and just I mean it leads to caries, it leads to really really messed up mouth. And so
Yeah.
I'm wondering, and I actually had a patient within the last couple of weeks. I told her you were going to be on the show. She was like, "You have to ask him." So she is on a CPAP, and there is tremendous dry mouth that goes along with being on a
Mhm.
CPAP, and it's been life changing for her. But she's wondering, how do is there anything they could do? It's all she's already using humidified air, like we're wiggling in all the places we can wiggle, and she's still having this really pretty relentless dry mouth.
So there are CPAPs now that are just nasal.
Mm,
And so
mhm,
having
mhm.
a CPAP that's just a nasal CPAP, and then, doing that oral facial myofunctional therapy and body work to train the mouth to stay closed at night
Oh,
and the tongue to stay
okay,
forward.
sure, sure,
And if,
okay.
I never want to, I want to make this clear, mouth tape. You should not mouth tape if you have sleep apnea without consulting with a provider.
Please,
So people think, oh, I'm
please,
snoring, I'll just use mouth tape. Like, no, no, no.
you need
So
air.
I so
That's
I will
yeah.
say this, but it is not
Thank
a
you.
recommendation. This is not medical advice, but if the patient
Thank
can
you.
breathe through their nose, then
Mhm.
something they could consider under the recommendation of a dentist or a sleep physician is
Mhm.
mouth tape, right?
Yeah.
If they just have a habitual
Okay.
open mouth posture, and
Mhm.
they can breathe just fine through their nose now with the CPAP, then
Mhm.
a little piece of mouth tape just across the front of the lips can just help to maintain those lips sealed. But yeah,
Okay.
a dry mouth, the bacteria that cause gum disease, gum inflammation, cavities,
Mhm.
they prefer environments that are low in oxygen. It's
Mm.
why they hide in the gum tissue, especially the bugs that cause gum disease. They hide down in that gum tissue because there's less oxygen.
Mm.
And
Okay.
as the mouth becomes dry, those species of bacteria can become more dominant. It starts to cause
Mm.
cavities and gum inflammation. Then we're swallowing those bacteria, and we swallow on average 5 grams of bacteria a day. So then that's going into the gut and causing, dysbiosis in the gut.
Ashley's face. I wish you could see this. And 5 grams of bacteria. That's a lot of zeros,
That's
people.
like that's like a
Yeah.
packet of like one of those packets of table sugar. I think it's actually
Yeah.
more. I think the table
That
sugar may be like 3 or 4
yeah.
grams. So it's
That's a
like pour
whole
that in
lot
your
of
hand,
zeros. Yes.
pour that in
Yes.
your hand, and imagine that
Right.
being billions of bacteria that you're swallowing. Because we swallow like 2,000 times a day, something
Yeah.
like that. Like,
Yeah. Yeah, you and your
it's
closest friends going down.
yeah, yeah.
Mhm.
And then when the gums are inflamed, and they bleed and they become puffy and red, even if it's
Mm.
more mild. That is an open doorway for those same bacteria to go in the
Mhm.
bloodstream. And this is wild. We will find these bacteria that cause disease. We'll find them at the sites of plaques that break loose and cause strokes and heart attack. We'll find them in the
Wow.
heart. We'll find
Yeah.
them in the brain. So there's
Mm.
one that can, at least one that can cross the blood-brain barrier called P.
Crazy.
gingivalis, and it releases a toxin called gingipains that's been associated with dementia.
I was just
Um,
about to ask. Yeah.
we'll see it in the breast tissue microbiome of patients diagnosed with breast cancer.
Wow.
And in fact,
Wow.
a lot of the oral bacteria that are um, good bacteria we find in the uterus. And the uterus has its own microbiome, but because oral bacteria makes its way down into the uterus, if we have gum disease, then mothers are more likely to have premature birth
Wow.
weight. And the theory is that those bad bacteria are getting to the uterus and then causing chronic inflammation, which then triggers,
Mm.
that
Mhm.
if affects those birth outcomes because of the inflammation
Mm.
that now is present in the uterus and in the womb. So it's
Wow.
Wow.
our mouth is connected to our body, and mouth breathing can just complicate all of these things.
Yeah.
That's
So
incredible. I
go
mean, we talk
go
about the gut
figure.
being
Go
like the
figure,
second
right?
brain, but
Yeah. Yeah.
but we don't really associate the mouth being talking to the the
Mm.
guts.
The
And
gut,
it's
yeah.
yeah.
So some of the oral bacteria, if they get down to the gut and start to populate the gut, it's associated with a higher incidence of mental health issues
Mhm.
like anxiety and depression. Um,
Absolutely. If
and the oral
antibiotic use too is
Yes.
oh
associated
yeah,
with depression. Yeah.
Mhm.
and oral microbiome is still, we don't know nearly as much about it as we do the gut and the skin, for example, and other
Mhm.
microbiomes. So it's still a blossoming area of research.
Yeah.
That's amazing.
Yeah.
Yeah,
That's a whole nother podcast of how to
Oh my
increase
gosh,
that
your
there's
is
like
yeah. There's so much
yeah.
stuff.
so many places to go here. Ugh.
Well, Dr. Clayton, this has been fascinating. I've learned so much already. Now, you're an amazing follow on Instagram. I love following you.
Mhm.
And I know you have a lot of educational resources out there. What do you have available for folks, and where can they find it? And where do they find you on the gram? How do people work with you? All the
Yeah.
things.
Well, we have a lot of great resources. We're really excited to announce that we are hosting an airway class.
Oh, wow.
So we'll be doing like a webinar class of sorts, and there's limited seats available. So we'll give you the link that you can post in the show notes. But
Yes.
we're doing
Wonderful.
a class, and then we'll have a Q&A, and really these live classes and Q&As are just my favorite thing to do. So super
Mm.
excited about that. That's something new that we're doing. And then if you're getting cavities and you don't know
Mhm.
why and you're frustrated, uh, our signature guide is the ultimate guide to curing cavities.
Yep.
It goes through all the risk factors that are missed and gives you actionable items to get out of the
Mhm.
cavity cycle. And we see a lot of wonderful results and feedback from that. And then our third guide that's very comprehensive, that's all about holistic dentistry, is called the Functional Dentistry Roadmap. And that's going to cover topics like airway and gum disease and clenching and grinding and nutrition
Mhm.
and cavities as well. And and then that will also go over, how to find providers and scripts for how to talk with these providers
Mm.
and find the
Great.
resources you need. So,
Yeah,
um,
and even if you're not local to the Treasure Valley, these are fantastic resources that you really should get your hands on, because no matter where you are in the country, there are biologic, biomimetic dentists that
yes.
are everywhere, and these guides will just kind of help you to put your feet on the path and get you going, to find the right help that you need.
Yeah, and we've designed, especially the cavities guide, we've really designed
Mm,
it to be a DIY.
Mm.
that's
You know,
wonderful. Yeah.
it's an education material, but it really is designed to help
Mm,
patients, because
That's
this isn't widely talked about enough
right.
and not treated
Right.
as comprehensively as it needs to be.
Mhm.
this really is a resource we've created to fill in all those missing gaps.
Okay.
And
And does it talk about remineralization? Is that
yes,
okay? Now
it
I
talks
have to
about
tell you,
remineralizing cavities
you
and
guys, you have to get this. You have to get this. And here's the thing. It's been my experience that, I'm in the medical field, and I don't know as much as I should about oral health. I'm learning. Um, but I have conversations with conventional dentists where, when I go and get my teeth cleaned, and I'm telling you, um openly ridiculed when I bring up something like remineralization, and it just it never fails to put me back on on my heels, because I just like, where is your curiosity about this? Where is your, people are doing this. This is happening. And so for you to, not not at least look into it, it can alleviate
yeah,
so much suffering and so much, but talk about preservation of tissue, right?
yeah,
And people not acknowledging, even in the field, not
yeah.
acknowledging that it exists,
And
is
yeah, and
frustrating.
something it's something kind of silly about that too is our body remineralizes tooth structure every day,
Of
all day
course it
long.
does. Look at bones.
Yeah,
I mean,
exactly.
we get a new skeleton every 14 years. So
Yeah,
it's, yeah, it's preposterous. It's
yeah,
just,
the saliva is mineral rich, and the saliva is
mm,
the maintenance system that remineralizes teeth because every time we eat a carbohydrate, the we lose tooth enamel. You know,
mm,
because the acidity level of our mouth drops below a certain threshold, we
mm-hmm,
lose enamel, then we,
hmm,
finish our meal or snack. Saliva is produced continually over the next period of time, and
hmm,
all those minerals that then bathe the teeth over the next, couple of hours, then undo the damage. I think,
mm,
and our guide really goes into the nuance. I think this is where dentists get frustrated. Is
yeah,
there's a lot of false advertising and
mm,
products that are snake oil essentially
mm-hmm,
that give people
mm-hmm,
hope that they can remineralize everything, when in the reality
mm.
is once there's a hole in the tooth, even a little tiny one, you can't remineralize it because
Okay, mm-hmm,
enamel is not a living tissue. So you can remineralize smaller cavities that don't have a physical hole in the surface,
mm-hmm.
and to the degree that they won't progress anymore. Um, but once there's a hole, tooth
You need to get
putties,
it
tooth
filled.
powders,
Mm,
whatever product, eggshells you want to throw at it.
hmm.
Well,
Yes.
we hear
Hmm.
all the
I bet you do.
wildest
I
things.
bet you do.
Coconut
Yeah.
oil. It's
Yes.
like
Yes.
it's like so we
Hmm.
teach people in that guide how to read X-rays, like how to
Oh
understand
wow.
their X-rays and how to understand which X-rays are good show cavities that are good candidates for remineralizing, which versus
Hmm.
which ones are hard fast no's. So we
Yeah.
really educate so patients can look at intraoral photos and at their X-rays and really be collaborative in their
Mm.
care plan and understand what the
Yeah.
limitations are, which is the
Exactly.
missing
That's
component.
important. Yeah.
Yeah.
That's important, because the pendulum swings way back and forth, and so
Yes.
no, that's fantastic. I love it. You guys, this I know this is going to be a much shared episode, and we really appreciate your time today. You've given us so much to think about, and so much knowledge here.
Yeah.
Thank
And
you.
how we want to always encourage our listeners is like we want to give you stuff to think about and go out and do your due diligence and be more educated when you go into whatever practitioner that you're going to go see, because the more knowledge that you have to go in, like the more you can
Mhm.
dice decipher.
What? The word is
Decipher.
decipher. I think you're looking for decipher. Ashley and I share a brain sometimes. I was using it just there. So, yeah.
But yeah, no, this was a fantastic.
Mhm.
I loved it. So I'm really appreciative of your time, Dr. Clayton, and um,
Yeah.
yeah, we were
Yeah.
just very very blessed to
It's
have you on. So
it's been a pleasure. Thank you so much for having me on.
Yeah. The content provided in the AA podcast is intended for informational and educational purposes only. The podcast is not a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. The information and opinions expressed in this podcast are solely those of the individuals involved and do not constitute medical advice.